my hope is that the government of Quebec, the Ministry of Health, and Sante Quebec can come together and find solutions to these long-term problems that we've been facing for decades now.
Quebec Health Minister Christian Dubé says the Transition Committee for the establishment of Sante Quebec will meet for the first time Friday to determine the steps to create the centralized health agency. Sante Quebec is one of the major components of the province's healthcare reform, Bill 15, which was adopted by the National Assembly on December 9th after the government invoked closure. It will be responsible for coordinating the network's operations, while the ministry will remain in charge of the major operations.
I'm trying to be hopeful and I'm trying to be positive that these changes could end up helping the system, but it seems like we're just going around in circles and we're not really focusing on the front line and what's occurring right now in the emergency rooms. What I would want to see from this transition period is the identification of the priorities that Sante Quebec will be focusing on during the next year or 2 years to ensure that the healthcare system stabilizes.
The committee will present progress reports every 4 months for transparency and will be made up of 11 members, including a doctor, former heads of government health authorities, and user representatives.
Please make sure that your advocates are themselves people who are representative of the sociocultural diversity of the province, with lived experience as patients, right? Don't handpick your friends and your favorite colleagues to do this. You need the lived experiences and the people who've actually had the challenges accessing healthcare in the system to be involved in the discussions about what Sante Quebec will look like, what it will do. There are a few former CEOs that might still be around that are both socioculturally knowledgeable about Quebec's population, and also they've had adequate experiences and have survived multiple healthcare reforms in the province. So I think they could bring that expertise to the table. I think also as they make the transition, they need to be looking at patient advocacy groups and considering having a patient advocate on the board of directors of Sante Quebec.
Dubé said on TVA Thursday that Sante Quebec is less about centralizing and more about coordination. He says next week they'll start accepting applications for the management team and plan to hire the head of Sante Quebec by April.
It's going to be someone that has a business background, and they'll be paying this person over $500,000 a year. Now, does this person actually have a real feeling of what's happening on the ground right now?
The transition team may add more experts to the committee depending on their progress.
People who are on the front line throughout the regions and the island of Montreal should be involved. And I'm talking about nurses, doctors, people in the emergency room, because they have solutions. It's just we feel our government doesn't listen.
In Montreal, Alyssia Rubertucci, City News.